Have you ever wondered what is the line of difference between the solid and the semi-solid dosage forms? You know what? Did I reveal today's topic? Welcome all to IS Pharmacology Difficult Podcast. I'm your host, Dr. Radhika Vijay, MBBS MD Pharmacology, and this is the audio hub to get the best, simplified, basic tips, strategies, methods, and lots of ideas to learn better, understand better, and make your concepts crystal clear. If you really find, and if there's a question hovering in your minds, is pharmacology difficult? Lend me your ears for a while and let in the magic of knowledge. Okay, now let me tell you that semi-solid dosage forms, yes, that is the topic of the day. They are the ones which lie within the thin line of separation between solid and liquid dosage forms. Neither solid nor liquid, they are semi-solid. The main ones that I'm going to talk about today are the ointment, pastes, etc. Let us start the talk with ointments. Drug in the ointments is kept in a greasy base. Now, what can be the different greasy bases? Well, think about them. Something like soft and hard paraffin, or wool fat, or beeswax. They are molded as semi-solid masses meant to be applied externally. Externally, like on nasal mucosa, ear canal, on your skin, and sometimes on anal canal. These are most common sites. Now, what is the nature of these ointments? They are actually occlusive in nature. And so, this is the reason why these preparations should never be applied on the oozing or the bruising surfaces which are actually bleeding, because they will pack the surface and no water evaporation can occur. So they are good on dry, chronic wounds and bruises, not on the wet ones. Some very good examples to mention at this particular point, they are soframycin skin ointment. I'm sure you might have used in your childhood so many times when you got hurt during your plays. Then it's a silver sulfadiazine ointment that is for the ophthalmic purposes. Another set of examples to be conveyed to you all. When in the ointment, the base is water miscible, it is better to designate this base as vehicle. So these ointments, they are well suited to be made as sterile eye ointments, especially for the drugs that can be used in such preparations. Well, you might have heard about atropine eye ointments or chloramphenicol eye ointments. Yes, these are the ones. They are available as sterile eye ointments preparations. Now, let us talk about creams. Now, these are actually a modified version of ointments. Now, cream is chemically an emulsion. What type of emulsion? You might be wondering, well, let me tell you, it's a water in oil emulsion. And the concentration is more than 20% of water and volatile oil, while there is less than 50% of hydrocarbons or wax or polyols. Now you should know one quick fact. Yeah, that's coming your way, that creams are better absorbed than the ointments. And cosmetically, they rank higher. You see, ointments have no place in the vanity box. Have you ever seen one? No, only creams are present. Again, creams are applied lavishly to the skin and the mucous membrane. Now let us go to know something about the pastes. Yes, they are the modified version of ointments. Then what is the difference? The difference is of the base. The base for the paste, it is non-greasy. Consistency is thick. And then what are added to these? Hydrophilic adhesive materials like aluminium, magnesium hydroxide, or zinc oxide, or prepared chalk, or starch material. Or sometimes some foamy agents can also be added like carboxymethyl cellulose, etc. And what is the basic nature of these foamy agents? They swell by absorbing water. Sometimes the contents may comprise of non-oily liquids like glycerol, propylene glycol. Now for a great worthwhile application, these can be applied on the bleeding, oozing surfaces or wounds. They can be applied conveniently on inflamed, excoriated skin. How can we do without the examples? So let me tell you the examples, the best ones in this regard, they are the zinc oxide paste. Am I forgetting something? Yes, toothpaste. Yes, the one that you use for brushing your teeth for your personal hygiene. And of course, there are medicated versions of toothpaste that are available in the market also. That was all about the pastes. Now, next head of conversations, they are the gels. In the gels, what happens? The drug is instilled in viscous colloidal material. It may be dissolved in liquid, and then it is dispersed in some gelling agent. The best one and the most common one is the soft gelatin. And how do we pack them, or how do you dispense these gels? Collapsible tubes. Yes, they are used to dispense or pack up these gels. How do these collapsible tubes look like? They are transparent. Sometimes they can be translucent also. Very good example, and the apt example here is the contraceptive gels. And gels are meant to be applied externally, mostly for long duration of stay or long duration of contact. One very good and compatible feature of the gels, they can be easily washed or wiped with water. They are actually non-sticky. They are non-greasy. So very conveniently you can apply on a hairy skin, especially on the oral ulcers. Just imagine, can a liquid or aqueous solution will stay on an oral ulcer? No, it will not. The best thing to apply on an oral ulcer is the gel. Aqueous solutions, they cannot be retained for a long time in the mouth, while the gels, they stay. One again modified form of gel I would like to talk about at this particular moment, at the right moment. Yes, I want to strike when the iron is hot. So these are the colloidal aqueous suspensions of hydrated substances. And these hydrated substances, they are inorganic in nature. One of the best example for such kind of a gel is aluminium hydroxide gel. Now last semi-solid form to comment upon, waiting in my list of the day, is the plasters. In these plasters, the drug is along with the resin base. Both are made in mixture. They are spread on a muslin cloth. Are you imagining the preparation? If you close your eyes and listen to me concentrating on my discussion, then definitely you can imagine the preparation of the plaster. So both are made in mixture. They are spread on a muslin cloth, and you can coat all this material with a water repellent film. And this whole complete pack, it stays firm and very hard at the room temperature, but once it comes in the body contact, it turns sticky. And they serve two important purposes: one of protection, and secondly, they are antiseptic in nature. Let us complete this talk head with wonderful examples of plasters. Band-Aid. I know you're saying that you knew it. It's okay. Now, did you know more? Something like zinc oxide plasters? Something like belladonna plasters? If not, then you know it now, right? For all the updates and latest episodes of my podcast, please visit www.ispharmacologydifficult.com, where you can also sign up for a monthly e-newsletter of mine. It actually contains a lot of updates about the medical sciences, drug information, updates, and my podcast updates also. You can follow me on different social media handles like Twitter, Insta, Facebook, and LinkedIn. They all are with the same name, is Pharmacology Difficult. If you are listening for the first time, do follow me here, whatever platform you are consuming this episode. Stay tuned. Do rate and review on iTunes, Apple Podcast. Stay safe, stay happy, stay enlightened. Thank you.